Hi, and welcome to Healthy Living. I'm Debbie Lyons here today with Kelly Presnell, Director of Marketing and PR for Hilton Head Hospital. We have a great, interesting show for you today.
Yes, Dr. Tracey Lever-Williams, she is a new OBGYN that is starting here at the hospital, has started at the hospital. She relocated recently this year, and she will have offices on Hilton Head and Bluffton to see patients. The women have been asking, we've had a need for OB in our market, so we're thrilled to bring her here as a complement with our great OB program.
I'm excited to talk with her.
Yeah.
Stay with us.
The vision for Hilton Head Spine Center is very clear. It's to provide world-class spine care to our patients.
Physical therapists were there. They were there holding you up. It's nice.
I just love working with all of these patients and their families and getting to know them and helping them on their journey.
My life is definitely better, and I'm glad that I came here to Hilton Head Hospital.
No one likes to wait, especially in any ER waiting room. I mean, when I'm sick or my family has a medical issue, I don't feel like waiting around with a lot of other people. Not to mention they're sick too. Honey. And my family does not wait patiently. You can imagine how uncomfortable and how long it can seem. But then I found out it doesn't have to be that way. I can check in online and wait anywhere I want. What's not to love?
It's the smarter way to ER at Hilton Head Hospital.
Welcome to Healthy Living. We are very excited today to have OBGYN Dr. Tracey Lever-Williams. Thank you very much for joining us.
Thank you for having me.
We've had a lot of fun talking about the way we want to structure the show today, talking about both obstetrics and gynecology. Okay. So again, can you talk to us before we get started a little bit about your background? A mother of 3 girls, I know that.
Mother of 3 girls, wife to an adoring husband. We have just moved to this area from Vidalia, Georgia, where we spent the last several years after being in Florida for training and traveling around with the Air Force before that. Got a pretty varied background and experience.
Yeah, it's wonderful. What made you decide to do OBGYN as a profession?
First of all, I couldn't imagine doing anything more rewarding than OBGYN. The chance to be with people throughout their life and to be there for the miracle of birth and to help escort people through times that may be very challenging that people don't think of.
Well, and it's interesting because I think from a consumer point of view or a patient point of view, I probably have more of a relationship with my gynecologist than I do any of my other physicians because, you know, they've seen you through childbearing all the way up through menopause.
That's right, and we get in pretty personal space.
Yes, we do.
So
well said.
You really have to be comfortable with whoever you're going to be sharing that kind of intimacy with, even though it's not true intimacy.
Well, let's talk first a little bit about the needs here at Hilton Head Hospital. I understand that there's quite a population of young women who are having babies, and so that's a good deal of what you are going to be doing.
Absolutely, and that's in any OB group, OBGYN, that we'd want that to be at least half of what we do. It's such an awesome opportunity, again, to be able to be there for these young folks, to be able to guide them safely through what can be a pretty scary time. It's exciting, but it's also so many things that can go wrong. It's such a great opportunity to have good experience and feel comfortable handling all of their emergencies and non-emergencies.
Well, let's talk about gynecology and obstetrics kind of along the lifeline, if you will. I have adolescent girls. You've got 3 little girls, too. At what point do you think a young woman should come in for her first gynecologic examination?
For an exam or for a visit?
Okay, let's do visit.
Because I think that they should come see me before they ever need an exam.
All right.
And certainly before they ever have the opportunity to become sexually active. I'd love to be able to have the opportunity to interact with the young folks, 13, 14 years old, just to say, you know, hey, this is what's normal with your body. This is what you're supposed to expect. Parents aren't always comfortable talking with their kids about those changes.
Well, you can be objective about everything.
Absolutely.
And then once they're getting ready to go off to college, can they, again, maintain a relationship with you?
Oh, for sure.
Okay.
And we always work around, you know, school breaks and that sort of thing. If people are going to be off somewhere out in the world and they want to keep, like you want to have your same gynecologist.
Exactly.
They want to have the same person so they're comfortable and know that they can confide if they need to, whatever.
Special issues as we begin into our early adulthood that you are concerned with or you think we should be aware of as women?
It's just always learning opportunities that at different stages in life. You're worried about different things. You're worried about sexually transmitted infections. You're worried
Birth
about
control.
Fertility, exactly, birth control. You're worried about learning what your normal body functions are so that you can identify the ones that aren't normal.
I just read a study recently that came out about birth control in women. What is emerging as the most popular or effective kind of birth control that you're seeing or that you would recommend?
Well, I think that there is a really big push right now for what we call LARC methods, or long-acting reversible contraceptives. Things like the Depo shot, it's maybe a little on the older side.
Okay.
IUDs or intrauterine devices, which are highly effective but completely reversible. The implants, which are good for 3 years at a time. They're not so invasive sometimes in the areas where people may not be comfortable with us working.
Okay.
But they're highly effective. They're as effective as having a tubal, but completely reversible, so kids can have control even if they make maybe an error in judgment.
How do you counsel folks for that? In other words, how would I even know what to choose? Am I taking an oral contraceptive, or do I go ahead and have an implant, or?
Well, I mean, you start with what's your lifestyle like? How is your memory? Are you going to be responsible enough to remember? I mean, everybody's got their areas that they're not responsible in. I don't trust myself with a pill.
Okay.
If it's something that's really important, my counseling technique is to say, hey, if you pull out of my driveway and you're going to go to Walmart and somebody tells you you've got a 98% chance of getting there today, or you could have a almost 100%, which is all we ever have, right? Which
I'll
one
have
are you
100.
going to? Right, you're going to have the one that's more effective.
Yes.
And so the pills, stuff gets in the way. Other medicines interact. You forget to take it. It doesn't protect the counter very well. So if you've got something that's right there in your body, then you're not having to worry about the compliance issues or forgetting. So you take the 100%. Don't take the 98%.
And then specific side effects for folks? I mean, do you look at different birth control methods for different population?
Of course, based on what their medical background is. If they're higher risk for developing blood clots, they may not need an estrogen. They may actually want something that's completely non-hormonal, and we've got that.
Interesting. Now we enter into the childbearing years. Fertility, you said, is an issue. What are some other things? Getting pregnant. It used to be, gosh, I'm 61, so I mean, we knew we were pregnant when we were, what, 12 weeks or 10 weeks, and now it's like, oh, yesterday.
Exactly. I think sometimes they know before the morning light comes
Right,
up.
exactly.
It's amazing the technology that's out there, but it's also amazing because so many women are waiting until later in life to have children. They're delaying for careers, for education, for things that just really weren't the case 40 or 50 years ago. We now have concerns about decreased fertility that comes with aging, and so we have to work around that sometimes.
When a person's been on birth control for 10 years and decides to have children or begin to try, is there a rule of thumb? In other words, if you've been off the pill, you try to go off at 4 months and then get pregnant, or is it no?
I don't think so.
Okay.
I actually tell people don't go off of it a month before you're planning on getting pregnant, but also understand that it could take 6 months after you stop. It's unpredictable, and certainly the minute you don't take that pill, you're already
You're automatically at risk. Talk to me, if you will, a little bit about as far as taking the pill, getting pregnant, and then going off of it? Are there any, if you get pregnant right away, no problems with any of that?
No, not at all. Because the hormones that are in birth control pills are actually similar to what is in your body naturally anyway, just in altered amounts so that it can suppress your ovarian cycle.
Because folks are finding out about pregnancy so early, advantages to that, disadvantages to that?
Well, advantages is you can definitely decrease toxic exposures. If someone wasn't planning it necessarily, they would know that they need to stop drinking, stop smoking, you know, any other bad habits that they might have. Even just altering the food that they intake, because some things are not appropriate during pregnancy.
And that was my next question. What are the guidelines right now for, again, it changes, it seems very cyclic. I know when my kids were young, it was have a beer, you may have a glass of wine. And then now it's pretty much no caffeine, no this, no that.
Well, caffeine is a little different, and that depends on which physician you talk to.
Okay.
I'm going to tell you, I'm a caffeine fiend, so I don't necessarily give my patients a hard time. As long as it's 3 cups of coffee or less during the day, that's not ever had any evidence of having a problem. Alcohol, there's no acceptable amount.
Okay.
I mean,
so
you can argue it either way, but there's just isn't.
Why? Yeah,
right.
Exactly. What about nutrition, food, things like that? Do you alter your diets, or do you find that people have a lot of cravings, and what causes that?
That's a good question. The cravings, I think we all have cravings all the time, and we just give ourselves a little more license during pregnancy. Certainly people's nose changes a little bit, though. There may be things that smell good or don't smell good that used to be completely different for them. And in that, I mean, there's really not a harm in allowing yourself a little craving or disgust of something that used to be good. But certainly there are a few things that you should avoid, things like cold foods, the cold cuts, hot dogs, anything that you eat really should have been piping hot at some points to prevent listeria. Soft cheeses are not in your favor at all, anything that's not been pasteurized. You should definitely eat seafood, and people always have questions about this. And the farm-raised stuff isn't good for you. It's got tons of mercury in it, and so you should be eating wild-caught stuff rather than farm-raised.
Which makes a lot of sense.
Otherwise, just vary the color on your plate, and you're going to have a good, healthy diet.
We're going to take a quick break, and we're going to come back and talk to Dr. Lever-Williams. Again, we're talking about the lifespan. We'll go ahead and talk about as we enter into middle age and then on into menopause, and more gynecology. So stay with us. We'll be right back here on Healthy Living.
Things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
Hilton Head Regional Medical Center is located at 25 Hospital Center Boulevard. When traveling east on William Hilton Parkway, make a left-hand turn on Beach City Road, and the next left, Hospital Center Boulevard will be located just past the Hilton Head Library.
Coastal Carolina Hospital is located on US 278 at Exit 8 on I-95. Telephone is 843-784-8000. On the web, www.coastalhospital.com.
Pain. It can be different things for different people. A shoulder that takes you out of the game. A knee that stops you in your tracks. Ready to return to a better you? Hilton Head Hospital is here, right in the Low Country, to help heal what hurts. From diagnosis to treatment to full recovery, our fellowship-trained orthopedic specialists are committed to getting you back to your best. Hilton Head Hospital. Extraordinary care right here at home.
We are back here on Healthy Living. We're talking today with Dr. Tracey Lever-Williams, OBGYN, and we've been talking about sort of obstetrics and gynecology through the lifespan. We touched a little bit on really when to come in for a first visit on up to having a baby. I'd love to talk now about our children are born, and as we age, what do you recommend? Is it still what are the guidelines or the standards for someone 35 and over?
Safer screening.
Yes, safer screening.
Right,
Thank
which
you.
is the most important thing that we can do to prevent disease. Everyone should still have an annual pelvic exam, including breast exam and all the rest of that.
Okay.
The question comes in, and there's a lot of confusion about it now with pap smears, and that's a lab test. It's not really the exam itself, but the pap smears, they're decreasing the frequency on.
Okay.
The testing is so much more accurate than it used to be that now it can be every 3 to 5 years, assuming everything was negative.
Oh,
and
interesting.
unlike
Okay.
used to be every year, but the technology has just changed so much and is so much more sensitive that we're safe with that.
When you're actually doing a pelvic exam, what are you looking for?
Well, anything that doesn't feel right.
Okay.
So an enlarged uterus, enlarged ovaries, anything that causes pain inappropriately, just tenderness in areas that should not be there. When we look at the cervix, we're looking for abnormalities that may be precursors to cervical cancer.
Do you find that I know you're not a primary care doc, but do you find that for many women, you act, because we see you every year,
Right.
in some ways you act as the physician that we confide in?
Oh,
okay.
absolutely. I mean, both for confidential reasons, as well as, I mean, gosh, if you have a cold and you don't have a regular normal doctor or whatever I am, I'm still going to cover that for people. I don't like to manage chronic illnesses.
So no diabetes, things like that.
Right, because that's better managed by somebody who's specifically trained. But we all went to medical school. If you got the sniffles and you're already my patient, certainly I'm not going to tell you, no, we can't fix that.
So again, 30s and 40s, what begins? When does perimenopause begin? The dreaded perimenopause.
Yes, perimenopause is such an unfortunate thing because it can last 10 years. So you can have, isn't that awful?
Well, what is it? I hear about it, but I always wonder.
Sleep disturbances, hot flushes, night sweats, changes in your skin, changes in just all the basic functions of your body all change a little.
Caused by?
It's caused by decreases in the youthful hormones. You know, the estrogen that we are used to having, our ovaries start to shut down and don't produce as much. The proportions are different. Testosterone starts to decrease as well.
You talked about women getting pregnant later. What does that mean in from a statistical point of view? When did we used to get pregnant, let's say in the 50s, 60s, and now?
Oh, I don't know that I can answer those with
that.
good statistics,
Right.
but I can say,
All right,
I mean,
anecdotally.
If I look at my mom's generation,
Yes.
my mom was 28 when she had me.
Okay.
I can tell you when I look around at the other people when I was growing up, my mom was old.
Oh, was she really?
And
Okay.
That is so much younger than I was when I was 34 when I had my
See, that's when my
oldest.
kids have had their kids, yes.
The difference, and it's some of it is socioeconomic change too. So some of the lower socioeconomic folks are still sticking to that, early 20s. If you don't have 3 kids by the time you're 25, then you're, shriveled up prune. But most of us are trying to delay that gratification until we're a little older.
More settled.
So we're settled, so we're financially able to take care of our kids. And so it's led to decreased fertility for these poor ladies, and they have a hard time getting pregnant sometimes.
Is that something that you can predict? If I have a woman who is interested in getting pregnant and she's 39.
It's so individual. It's
Okay.
not really predictable, but I would say someone who's very healthy in 39, that's another thing that's changed. The health is so much better now than it was 30 years ago. That's not so much of a problem. A healthy 39-year-old should still be able to get pregnant.
What about genetics? If your mom had no problem getting pregnant, does that play a part in how you even have babies, carry babies, get pregnant?
It actually can have some effect. If your mom had infertility issues, then it might have been related to, say, endometriosis. And there is definitely a genetic link there. So if she had endo, you could have it, and so you don't want to delay in that case because that can, really be detrimental.
Exactly. I keep sliding back to the younger girls. Let's go ahead and go from 45 to, let's say, 60 and above. What can we predict? What's different? What do we need to be prepared for from a gynecologic point of view? Menopause?
Menopause, of course. As you age along that time frame, that's definitely when breast cancer gets to be more and more common. So every year you should have a mammogram, and every year a clinical breast exam, which means somebody who's felt more breasts than just yours should be doing the exam so that you can make sure that smaller items can be felt if they're abnormal.
Okay, that makes a lot of sense.
It's much more important to do your own breast exam during that time too, because we all have lumps and bumps, and you need to just get to kind of know what your gravel is there as I reach up and
exactly. Well, but I mean, it's the truth. Exactly. Tea and touch. I mean, it is what it is.
You have to. So those things are much more of a concern in that age group.
From a gynecological point of view, do you deal with sexual issues also?
Oh, absolutely. That's a very common time for people to start to have problems with dryness, with discomfort during the act of intercourse. And sometimes there's also just decreased desire issues. And these are all things that some can be dealt with by counseling the patients and explaining that they're really normal. That's a lot of it, just to know that you're not crazy.
Right, exactly.
Then also, there's some pretty minuscule treatments that we can do that can make such a tremendous difference in your life at that point.
What about something like incontinence for women also? Is that something that would be, I guess, information that would help you when I come in as a patient? Here are the things that I'm experiencing.
Oh, absolutely. Those things can be so frequently, easily, with minute adjustments, tweaked and made better. You could do something as simple as Kegel exercises, which we won't have to demonstrate or anything, but stopping your urine midstream to strengthen all the muscles of the pelvic floor can make all the difference in the world for sexual function, for urinary continence, and there's surgical procedures that can be done to aid with that, which we would do in conjunction with urology, if necessary, after the other stuff.
I hear about things as we get older, things like fibroids or benign tumors, things like that. Hysterectomies.
Well, hysterectomies are definitely a fact of life. They are very commonly performed surgery. They can make all the difference in the world for someone who's had horrible menstrual cycles or horrible pain, but a lot of times they're avoidable now. And that's the thing, it's not a disposable organ. God gave us what he gave us so that we could have it throughout life. Yes, we're smart enough to take it away if there's a way to fix something, but it's not always broken. Sometimes there's little hormonal tweaks that we can do. A large fibroid uterus, hormones aren't going to help that. If it's taking up your whole belly, it's probably time to get it out of there. Otherwise, we should be leaving things alone a lot more than we used to.
You bring up hormones. What are the thoughts of hormones as we age?
Hormone replacement used to be thought of as something every woman went on at a certain age.
Okay.
Now our thought process is a little bit different. If you have symptoms that require treatment, if they're disturbing your normal daily function, hot flushes.
So it's quality of life, right? Yeah, I can't talk to you because I'm having hot flushes.
Exactly.
Right.
If you're doing that all the time, if you can't sleep at night, if you're waking up with the sheets needing to be wrung out from sweat, you need hormones. They're safe.
Okay. I just was going to ask you.
There are reasons why some people may not be good candidates for them, but I think we really erred way on the other side for a while there where nobody could get hormones for any reason. There's no reason for that. There's actually benefit to women not having what we call a hormone vacation, that 5 or 10 year period of time where you just felt like you had to suffer through it and then you want to start something. That puts you at increased risk for heart disease and all kinds of things, which those risks aren't there if you get on them at the beginning of the symptoms and then control them.
I was going to say, do you gradually then taper as you get older?
The lowest amount for the least amount of time is the
So when you're 106, you might be tapering off?
106. If you're still here at 106, I'm going to give you whatever the heck you ask for.
Again, as we get older, do you still like to see us every year? What's your thought on that?
Yes, I think that it's very vitally important to continue to come in every year. You need to have somebody that is doing that clinical breast exam. It does get to a point where it doesn't necessarily have to be your gynecologist. If you've had your uterus taken out, you've got your ovaries taken out, and all you have left is the breasts as far as female organs go, it's sure reasonable, as long as you're seeing any doctor who does a breast exam, to do that annually. And getting the clinical breast exam along with the mammogram, perfect. Otherwise, once you get to maybe mid-70s, if you've had a normal, benign course and no problems, every year to 2 years, anything more than that is too much.
It's so fascinating. It's really interesting, and I think we could sit here and really spend about 6 hours talking and not even hit the tip of the iceberg, but really appreciate your time. We want to thank all of you for joining us here on Healthy Living. Have a great week.